The Sustainable Development Goals aims to transform our world by the year 2030, and the United Nations set out 17 goals, which includes 169 targets, with SDG 3 set to ensure healthy lives and promote well-being of all at all ages. Yet tobacco use is on the rise in Ghana, constituting to about 6,700 deaths on a yearly basis. Tobacco, the single most preventable cause of illness and death, has about 1/3 of adults in the region estimated to be smokers. The mission from the World Health Organization Framework Convention on Tobacco Control at the second assessment of the status of documentation on tobacco control applauded the Food and Drugs Authority, Ghana, for the progress made in eradicating public smoking, enforcing the laws, and efforts to curb illicit tobacco trade. Almost all member states in the WHO European region have ratified the WHO Framework Convention on Tobacco Control, which contributes to saving lives and improving global health since 2005, and Ghana, since the last assessment in 2010, has continually made significant progress in tobacco control with the help of the passage of the Public Health Act, Act 851, Act 2012, the adoption of the Tobacco Control Regulations LI 2247, implementation of graphic health warnings on all tobacco products packaging, and the ban on advertisement on tobacco products. Dr. Mrs. Olivia Ejikumwa Boateng, Director, Tobacco and Substances of Abuse Directorate of the Food and Drugs Authority, who also doubles as the focal point for tobacco control for the WHO FCTC, admonished that Ghana has ratified the whole protocol to eliminate illicit trade in tobacco products and is presently exploring the adoption of comprehensive smoke-free policies to be implemented soon.
On restricting access to wine and says you are not supposed to expose children below 18. You are not supposed to send them. You are not supposed to buy. You are not even supposed to buy. When you default and you don't take the ID and you sell to a minor, we can take you on. We are also supposed to sell. We are not supposed to sell single sticks, so that it will be a pack of 10 or 20, so it will be comparatively more expensive, so that they cannot afford. To a large extent, we've been able to enforce it because we did the packaging to reflect the size of 10s and 20s in the law. But we still have issues with tabletop, people selling small quantities of it. We've had issues where children are in homes where parents smoke and they have reported, but the law won't go to a home. The law can only go to a car if there's a pregnant woman in a public transport if there's a pregnant woman and a child. But it cannot go to private vehicles, it cannot go to private schools. So we are having problems enforcing that. But what we seek to do to remedy the situation is to do public education in the schools, routinely, even from basic, the preschools, for them to know that these are dangerous and this is even a law that is protecting you. Your parents is not supposed to send you, and so by giving them information and empowering them, that's how we are going around it. Because as it is, we keep seizing table talk, but we go to our communities and we still find the change. So it's a lot of advocacy that we are doing in these communities.
Dr. Bafo Ewua, advisor to the Minister for Health, Kweku Agyeman-Manu, said the assessment must be supported by all member countries to identify the gaps in the documentation process and profess solution to be achieved by the year 2030. Tobacco kills more than 8 million people globally every year, and more than 7 million of these deaths are from direct tobacco use, and around 1.2 million are due to non-smokers being exposed to secondhand smoke. This evidently has placed a tremendous toll on global health, for all set to be realized by the year 2030, and recognizably an impediment to the attainment of the Sustainable Development Agenda. The 2030 Agenda for Sustainable Development outlines specifically the critical need for effective tobacco control in Target 3 Clause A, which states strengthening the implementation of the World Health Organization Framework Convention on Tobacco Control in all countries.